Hi, welcome to another episode of Dr. Harris's Herbal Tutorial. I'm Richard Harris, and in this episode, I shall be discussing a special category of herbs called heat-clearing herbs, which are mainly indicated for clearing or cooling heat, often described as fever. These herbs do this by regulating body temperature of a feverish patient, that is, a patient with heat signs. Do you remember the times your mother would look at you and exclaim, "You need cooling," or "You need a purge," "You need a clean out"? She was seeing heat signs. That exclamation was usually followed by one of the following: some castor oil, some senna, global salts, or some bitters. These are all agents that cool heat. It was never cinnamon, bay leaf, or ginger. They knew these herbs were impractical in these circumstances. Like the different names of the herbs in the respective Caribbean country, the choice of cooling also depending on where you come from in the Caribbean. In traditional Chinese medicine, fever is not the same as fever in Western medicine, though they are somewhat related. In Western medicine, fever is basically a rise in body temperature. In TCM, the rise in body temperature is considered as fever, but fever also includes the presence of feverish symptoms without an increase in body temperature, such as redness of the face, irritability, thick yellow urine, thirst, dry mouth, fondness for cold drinks, rapid pulse, bad breath, foul-smelling stools, yellow discharges, burning sensations, etc. Generally, herbs that clear heat have a cool or cold energy. It is wise to suspend the use of these herbs when feverish symptoms have subsided. Heat-clearing herbs are subdivided into 5 categories. 1. Herbs that clear heat and reduce fire. 2. Herbs that clear heat and dry dampness. 3. Herbs that cool blood. 4. Herbs that clear heat and detoxify. And 5. Herbs that clear heat and relieve summer heat. In clinical practice, before selecting the appropriate heat-clearing herbs, the necessary steps must first be taken to identify the location of the fever, see whether it's located in one or more organs, whether it is in the upper or the lower region, whether it's in the energy or in the blood level, if it is one of excess heat or deficiency heat. Is it real heat or false heat? No guessing games here. Diagnosis is essential to achieving success. Example, heat in the blood may cause hemorrhaging, but with feverish symptoms. Heat in the bladder may cause dysuria with heat signs, or scanty deep yellow urination. At times there is bleeding. Heat in the liver may cause jaundice with heat signs. Again, I must emphasize that these episodes are not a treatise on TCM. I'm simply trying to give some context of why and how herbs are used and the rationale behind their selection. Traditional Chinese medicine is technical and exhaustive. Thus, if anyone is interested and wants to know more, there is a library of printed material on the subject. Generally, heat-clearing drugs have a cool or cold energy. Long-term uses with no regard for the energetic action may affect the proper functioning of the spleen and stomach, or even the kidneys. It is therefore necessary to be cautious when there is diarrhea, poor appetite, vomiting, weakness of the stomach and spleen, and a tendency to feel cold easily. Clinically, these herbs are used alone or in combination with toxic herbs. That's all for now. If you find this video useful, why not check out my other YouTube videos for more such interesting topics? It would also be nice of you to remember to like, share, and subscribe. Don't keep it to yourself. Others need to know too. Bye.